Happening now at 5, could cuts be coming to Medicaid? About 5 hours ago, hundreds of healthcare and public service workers met with members of Congress to make sure Medicaid continues to be fully funded.
Our Melissa Kim is live on Capitol Hill with what we know about the direct impact on families that truly rely on this. Melissa.
Well, good evening there. Medicaid is the largest health insurance program in the country. It helps cover costs for those who have limited income. Now, 80 million Americans depend on the program, nearly half of them children, and healthcare workers say that any cuts to the program could be detrimental to our public health. Jacqueline Joy Lasola is an obstetrician gynecologist at the University of California, San Francisco, and was once one of the millions of Americans who depended on Medicaid.
On a personal level, I was a single mom who also relied on Medicaid to be able to pay for my child's health care as well as my own to get through college as well as medical school.
Children account for half of the 80 million Americans who currently get health insurance through Medicaid. Dr. Lasola was joined by hundreds of others on Capitol Hill Thursday morning to make sure Medicaid does not face the financial chopping block in Congress. April Verrett is the president of SEIU International, which represents healthcare and public service workers.
Gotta stop this business of letting the uber rich, right, and way too powerful corporations dictate what this country is, and we need to actually pay attention to what everyday working Americans want and need.
Dr. Nakisa Hagigat from California on that need.
If you're a human being, you need health care. It doesn't matter who you voted for. It doesn't matter what political side of the political spectrum that you come from. I think we all agree that health care is a basic human right.
President Trump spoke about Medicaid last week. He said then it would not be cut, nor would Medicare or Social Security. But he did say his administration would be making sure the money was being used properly. Which brings us to the Department of Government Efficiency, or DOGE. WSA 9 obtained a copy of an email sent to employees at a federal contracting company. It states that they have been made aware of certain requests from DOGE to be granted access to specific information systems. Unwelcome news for Verrett.
And that is saying not just hands off Medicaid, but hands off of our personal information. DOGE doesn't need our Social Security numbers. They don't need our tax returns. They don't need our personal medical information. It's an overreach, it's unnecessary, and we're willing to do whatever we have to do to put a stop to it.
That email from the contracting company directs employees to reach out to leadership immediately and not give DOGE any information. Now, a federal judge has temporarily, or partially rather, blocked DOGE's access. In the meantime, we have tried to reach out to DOGE. They do not appear to have a media relations representative at the moment. We've also tried to get some answers from the White House, and we'll continue to update you when we get those answers. Guys.
Also, we know Dr. Oz, who will be the head for Center for Medicaid and Medicare, will be confirmed next week. We'll attempt to be confirmed, so we'll keep an eye out for that as well to see if that gives us some direction. Melissa, thank you.